Hi, I'm Dr. Bloxham with Columbia Center for Sleep Apnea and TMJ in Richland, Washington. And wanted to put together this quick video for those patients that are coming in for the Solea laser snoring treatment. And just wanted to give you a quick rundown of what you need to expect your first appointment and a couple of things that we'd like you to do before your first appointment, just to make things go a little bit quicker and so that you understand what we're going to be doing. So one of the things that has been helpful for a lot of our patients and helpful for us is to download an app on your phone that'll actually record you snoring before you come in. And it's called SnoreLab. And so you can just go to your app store and SnoreLab. And how this works is at night, as you're getting ready to go to sleep, you'll just put this beside your bedstand, you'll hit the start button, and it'll tell you good night, and then it'll actually record you throughout the night. So it'll record your snoring, it'll record kind of how loud it is and how often it occurs, and it'll give you a score. Now we can use that before and after the treatment to see how things are improving, and it gives us a kind of a numerical value and a recording of how things are going. And so a lot of our patients have had fun with that, and we've seen some great results with that as well. So when you come to your appointment, first things we're gonna make sure this is something that is gonna be effective for you and something that you're gonna be a candidate for. So one of the first things that we have to do is check for nasal breathing. Make sure that there aren't any obstructions, that you can actually breathe through your nose. That's how we should be breathing. And so if we're breathing through our mouth and trying to breathe through our nose, snoring is gonna be a lot louder and a lot harder to control. So just gonna be making sure that you can breathe through both sides, that there aren't any obstructions, that you don't have a deviated septum or something that is causing some nasal snoring instead of the soft palate, which is what we can really have some great effects for with our laser. So after we have determined that you have good nasal breathing and that we take a look at the back of the throat and see how thick your soft palate is, how long it is, and if it's something that this laser is going to be able to help. And so once we have established that you're going to be a candidate for the treatment, and this is something that we can do for you, then the treatment itself goes pretty quickly. And it takes about 15 minutes or so. And the patients report that the worst part of the appointment for most is actually the anesthetic spray. So this is the anesthetic spray. And how this works is, I'll show you, I'll demonstrate it here in just a second, but we actually have you open your mouth and I spray this in the back of your throat, and it helps reduce the gag reflex because we are going to be working towards the back of the throat, and it helps numb things up a little bit. And so this laser can get warm on the tissue when we're using it, and this just helps decrease that. And for most patients, it's something that is fairly quick and painless and easy. But again, this anesthetic does not taste very good, so we'll warn you about that up front. And so I'm going to use it on myself. So okay, it's not that great tasting, but it takes just a few seconds. We give that a few minutes to start taking effect. And then we will have you wear a pair of laser safety glasses. So this laser is a laser that can cause damage if we're not careful. And so we always have everybody with the proper safety gear. And then it's just, we lift you up, set you back. So you're gonna be laying back in the chair. And then at that point, it'll be like about a 15-minute dental appointment. So the assistant will be helping and we'll be going through the laser treatment. Now with the laser, we're gonna be using the laser on the entire soft palate and your uvula and the sides of the muscles that come down, just to tighten everything up and to keep that from vibrating, which is what causes snoring. So looking forward to seeing you here in the office, and looking forward to being able to help you get a better night's sleep and a quieter night's sleep. And so we'll see you soon. Thank you.